Hello and welcome to Stony Brook Medicine's Healthy Libraries program. And today we have a webinar titled Coronavirus Updates. I would like to thank the public libraries of Suffolk County, especially Brentwood, Patchogue, Medford, Longwood, and Huntington. We have a great presentation and let's get started. Just before we get started, I see we have a few participants today, and I just want to make sure that we're covering the information that you're interested in. So would anyone like to let us know what you're really interested in so we make sure that we include, because we have a lot of information today. Would anybody like to speak about why you're here today? And that's okay if you don't. We have a lot of information for you, and if you have any questions, please type it in the chat box, or you could ask the questions at the end of the presentation. Okay, next slide, please. All right, so we want to begin. we want to let you know a little bit about our Stony Brook Medicine's Healthy Libraries program. This is a partnership with the public libraries of Suffolk County, the Suffolk County Cooperative Library System Outreach Services Department, and it's supported in part by the American Heart Association of Long Island. This program is an interdisciplinary team of public health, nursing, and social work students whose aim is to provide evidence-based health information, screening, and case management to a diverse community of patrons in the public library setting. Another aim is to refer patrons to promote access to appropriate health and social services programs locally that will address their health and social support needs. And lastly, for students to experience an interprofessional team and demonstrate the core competencies based on the interprofessional education collaborative. So I just would like to introduce some of our student leaders. We have Gwyneth Mercep, who's an undergraduate student, Bachelor of Science in Health Science, Philip Massaro, nursing student, Bachelor of Science in Nursing, Winnie De Los Santos, undergraduate student, Bachelor of Science in Social Work, and Christine Weber, graduate student, Masters of Social Work. Some of our faculty and staff leaders is Dr. Lisa Ben-Scott, Professor and Director, Program in Public Health. Myself, my name is Mary Ellen LaSala, and I'm the Chair of the Department of Undergraduate Studies, School of Nursing. We have Marie Boone. She is a nurse practitioner, public health nurse, and clinical professor, School of Nursing. We have Leah Topek Walker, is a licensed social worker, field education coordinator, School of Social Welfare. Jennifer Coos, she is our health sciences librarian, School of Medicine, Program of Public Health and Biomedical Informatics. And Gabriella Pandafelli, graduate student, Master of Public Health. And now I would like to turn this over to the students. These are nursing students at Stony Brook School of Nursing. And Lauren, would you like to begin introducing yourself?
Hi everyone, my name is Lauren McDonald. I'm a senior nursing student at Stony Brook University, and I'm working on my Bachelor's of Science in Nursing degree.
Hi, I'm Ira Mercado, and I'm also a senior nursing student in Stony Brook University, trying to get my Bachelor's of Science in Nursing.
Yay.
Hi everyone, my name is Janine McFarland. I am also a senior nursing student working on my Bachelor of Science degree in nursing.
Wonderful. And Philip?
Hi everyone, my name is Phil Massaro and I'm a senior nursing student as well.
Thank you. And this is me. I'm the chair of the Department of the Undergrad Studies. So now I'd like to turn this over to Philip, who will guide us in our pre-webinar poll. Philip?
Hey everyone, hope everyone's doing well today. So we have a pre-webinar poll, which is just a few questions just before we get started, just to gauge everyone and see how everyone's doing. We did not collect any personal information or anything that might be specifically related to you guys who are attending this webinar. So you should see the poll pop up on your screen. If you don't mind just taking a few seconds and completing that poll, and we'll get started as soon as everyone's done. All right, everyone, thank you guys very much for participating. And I'm going to finish the poll now, and we'll get started with the presentation. I'd like to introduce Professor Buen, who will continue over the learning objectives for us.
Hello, everybody. Our learning objectives for this session is participants by the end of the session will be able to identify the symptoms of COVID-19, identify how COVID-19 is likely to spread, identify the lowest effective alcohol percentage in hand sanitizer, identify how to properly wear a mask, identify the definition of a diagnostic COVID-19 test, identify who should get tested for COVID-19, and identify how much a COVID-19 test costs. Again, please, just a quick reminder to please put your computer on mute. And if you would like to ask a question, please enter the question into the chat, and we will work to answer your questions at the end of the presentation. I would like to now present to you Philip, who will continue with the in-service.
All right, thank you, everyone. So today we're going to talk about COVID-19. We're going to talk about a few things about any updates we might have had over the past few months. For some, it's been a very difficult few months, and we're still adjusting to new life, how we're doing certain things with new regulations coming out each day, each week. So we're going to cover all that for you guys today. So discussing what is COVID-19. COVID-19 is an infectious disease caused by a new coronavirus called SARS-CoV-2. It is part of the coronavirus family, which is similar to the virus causing severe acute respiratory syndrome, or SARS, which causes a respiratory illness. It was first discovered in Wuhan, China in December 2019 and has spread globally, creating a pandemic. COVID-19 is caused by infection with a new coronavirus called SARS-CoV-2. In COVID-19, the CO stands for corona, the VI for virus, the D for disease, and the 19 references the year that the virus was identified. The coronavirus that causes COVID-19 is thought to spread from person to person with respiratory droplets produced when an infected person coughs, sneezes, or talks. So what are the symptoms of COVID-19? Some symptoms might include a cough, shortness of breath or difficulty breathing, chills, sore throat, loss of taste or smell, muscle pain, a fever, running nose, diarrhea, feeling nauseous or vomiting, feeling very tired, having a headache, and even a poor appetite. So there are multiple different kinds of symptoms, and people with COVID-19 have reported symptoms from a mild severity and to some more severe than others. And symptoms often appear 2 to 14 days after exposure to the virus. So who's at risk for COVID-19? Anyone can become infected with COVID-19. Some individuals are at a higher risk for severe illness, such as older adults or people with these other comorbidities, such as COPD or chronic obstructive pulmonary disease, asthma, heart disease, hypertension, diabetes, obesity, chronic kidney disease, and some other comorbidities or other conditions that people might live with every day. So we're going to take a look now at the data and the numbers and try and help you guys to understand what might be going on over the past few months. So according to the Centers for Disease Control and Prevention, or the CDC, their name is thrown around a lot, right? It's the federal government's very well-respected center who conducts research and information about certain things like the coronavirus and other diseases throughout the country. So as of 9/14 or September 14th in the United States, the highest percentage of COVID-19 cases were in the 18 to 29-year-old range at 23.1%. The highest percentage of deaths were in the 85-plus range at 31.6%. Now, cases by race or ethnicity show white non-Hispanic population at 51.5%, the Hispanic Latino population at 30%, the Black African American population, non-Hispanic, at 18.7%, and the Asian non-Hispanic population at 3.4%. The highest percent of cases were females at 51.8% when compared to males at 48.2%. And the highest percent of deaths were males at 54% compared to females at 46%. So now we'll take a look over at Suffolk County, where we live in this county in New York. As of September 14th, 2020, 733,917 total COVID-19 tests have been performed. Of those tests, 45,895 tested positive. And we had in Suffolk County 2,010 total deaths up to date. For New York State, as of September 14th, 2020, there were over 9,381,000 total COVID-19 tests performed throughout all of New York State, including our county and counties across the state. Of those cases, 444,000 tested positive for the coronavirus, and of those, 25,394 total deaths. Now, looking at New York, this graph, looking at this slide right here, shows the daily totals versus person tested and the persons tested positive. You'll see there's two different graphs on here. The larger blue-looking graphs on those lines, which continue to increase through March on the left through September now on the right, those are total persons that were tested for the coronavirus. As we continue over the past few months, you can see that the amount of people being tested for the coronavirus have continued to increase. However, the amount that have tested positive completely goes down, and it looks, you cannot even see it towards the end of the graph towards September, that we are testing more and more. So this is a great graph for New York State. Now, looking at the United States, globally, the United States leads in the number of total cases. As of September 14th, 2020, the total cases in the United States was 6,553,000 cases. The total number of deaths in the United States was 194,467 total deaths. And that's reported, again, by Johns Hopkins University for COVID-19. And you can see that this graph shows you from February 2020 to now September 14th, 2020. So you can see this is throughout the entire country, and you can see a rise and fall throughout the months when it first came to the United States, and as people were continuing to get infected, as it lowered a bit in May, June, and we saw a very large spike over the months of July and August, and now what looks like it seems to be slightly going down as the days continue. So we went through a lot of numbers just now, but what does this mean for you? COVID-19 is still a threat, and there are new cases every day. Prevention seems to be controlling the spread of the disease, and it's important for us to take a focus on that. We must remain vigilant to contain it until there's a treatment for those who are symptomatic to prevent critical care, or a vaccine to prevent further infection. So I'd like to pass this on to my colleague, Ira, who's going to talk about COVID-19 primary prevention.
So there are a couple of primary preventions to reduce your risk of getting COVID-19. They are to wash your hands, wear a mask, cover your mouth when you cough or sneeze, and keep a 6 feet of space between you and others. How to stop the spread. COVID-19 is thought to spread through respiratory droplets that is produced by someone who is infected with the virus. An infected person can spread the virus through coughing, sneezing, or talking. Someone else nearby could inhale the virus into their lungs, which could then infect them. So the best way to prevent the spread is to wear a mask, hand wash, and socially distance. In this image, you see someone who is a COVID-19 carrier and someone who's a healthy person. As you can see, the risk of spread is very high if both people don't wear masks. However, when both wear masks, the risk of spread is very low. So it's very important that everyone wears a mask. Should you wear a mask, cloth, face covering? Yes. The link below leads to the Centers for Disease Control and Prevention, also the CDC, and they have additional information for those who want to learn more. Are face masks effective? Yes, they are. In community settings, cloth masks may be used to prevent community spread of infections by sick or asymptomatically infected people. Multi-layer cloth masks designed to fit around the face and made of water-resistant fabric with a high number of threads and finer weaves may provide reasonable protection when used correctly. Who should wear a mask? New York state law requires everyone above the age of 2 to wear a mask in public and when social distance cannot be done. With those who have a history of asthma and cystic fibrosis, wearing a mask in public is standard. If you have any questions, you should contact your healthcare provider. For those who are deaf or hard of hearing, consider wearing a clear mask. If a clear mask is not available, use written communication or closed captioning. Mask versus face shield. The CDC does not recommend the use of face shield as a substitute for mask. How to properly put on a mask. So before putting on a mask, you should wash your hands. The mask should cover the face from the bridge of your nose to underneath the chin. You want to make sure that the mask is loose-fitting, but is secure enough to stay in place. If at any point the mask is touched, you should wash your hands with soap or hand sanitizer. How to properly remove a mask. When removing a mask, you want to grab the strings or the ear loops. You want to avoid touching the front of the mask, and you also want to avoid touching your eyes, nose, and mouth. Immediately wash your hands after removing them to avoid any further potential contamination. Types of mask. Cloth or cotton. So it should not have any exhalation valves or vents, as that could allow viral particles to escape. If made and worn correctly, cotton masks can provide enough protection. It should be washed regularly, either using a washing machine or by hand. If you're doing it by hand, you want to use a bleach solution that contains 1/3 cup of 5.25 to 8.25% of sodium hypochlorite per gallon and let it soak for at least 5 minutes. Surgical mask. These should be worn by healthcare workers in a patient areas, but they do not directly work with COVID-19 patients. These masks are meant to help block large particle droplets or sprays that might contain bacteria or viruses. If soiled or damaged, it should be discarded and replaced. The surgical masks are not intended to be used more than once. Mask with an exhalation valve. Presence of an exhalation valve reduces the exhalation resistance, which makes it easier to breathe or exhale. Respirators with these type of valves should not be used because the valve may allow unfiltered exhaled air to escape. If you only have a respirator with an exhalation valve available, you want to cover the valve with a face mask, either a surgical or procedural mask, that does not interfere with the respirator fit. N95 respirator. These are intended and should be worn by healthcare workers who are dealing with COVID-19 patients. They are designed to achieve the closest fit around the nose and mouth. If they are soiled or damaged, it should be discarded and replaced, and these also should not be used more than once. The N95 classification of air filtration means that it filters at least 95% of the airborne particles. Now I'm going to pass it on to my colleague Janine, who will talk about the other primary preventions and other safety precautions.
Hi, everybody. We're going to talk about other primary preventions. One is known as social distancing, also called physical distancing, means keeping a safe space, which means 6 feet or more between yourself and other people who are not from your household. Social distancing helps limit opportunities to come in contact with contaminated surfaces and infected people outside the home. Okay, another primary prevention option is hand washing. Washing your hands is one of the best ways you can prevent the spread of infection. Germs can spread from other people or surfaces when you touch your eyes, nose, and mouth with unwashed hands, prepare or eat food and drinks with unwashed hands, touch a contaminated surface or objects, blow your nose, cough, or sneeze into hands, then touch other people's hands or common objects. So the most important times to wash your hands are before, during, and after preparation or consumption of food, after using the restroom, especially in public places, after handling garbage, animals, or caring for someone who is sick, after blowing your nose, coughing, or sneezing, after touching frequently touched items like door handles, tables, gas pumps, and shopping carts, and before touching your eyes, nose, or mouth, because that's how germs enter our bodies. So you might be asking, what is the correct way to wash our hands? We can follow these 5 easy steps from the CDC. You're going to want to wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with soap. Lather the backs, between your fingers, and under your nails. Scrub your hands for at least 20 seconds, and you can think of the happy birthday song twice if you need help. Rinse your hands well under clean running water, and then you can dry your hands using a clean towel or air dry them. If you're in a pinch, you can use an alcohol-based hand sanitizer that has to be at least 60% alcohol contained, and you can use that for 20 seconds when hand washing is not available. Okay, we're gonna move on to cleaning and disinfecting. COVID-19 is thought to spread through respiratory droplets. However, the transmission of the virus to person from a contaminated surface has not been documented. Currently, there is evidence that the virus can stay on surfaces from days to hours, depending on the type of surface. The best practice of preventing the contamination and spread of the virus is to clean and disinfect any visibly dirty surfaces. It is important to both clean and disinfect. Cleaning only removes any germs and dirt on the surfaces. Disinfecting kills the germs remaining after cleaning. Clean and disinfect any surfaces that are used and touched daily, such as doorknobs, light switches, remotes, sinks, phones, keyboards, and handles. You're going to want to clean the surfaces with a detergent or soap and water before disinfecting them. Keep in mind of the instructions on the disinfectants. Some may require the use of gloves to avoid any skin irritations. Here are a few disinfectants from the CDC recommends for use against COVID-19. You have Clorox Pro, germicidal bleach, Clorox disinfectant wipe, Lysol laundry sanitizer, and disinfectant spray. Okay, and this slide is a picture just mentioning the key times to disinfect your home. Daily, this includes table, doorknob, light switches, countertops, handles, and phones. If someone in the house is sick, after they touch additional surface that someone else in the home may touch, you would want to clean after that. Make sure to keep cleaning supplies out of the reach of children. And remember, when you're cleaning, use soap and water to clean dirty surfaces prior to disinfection. And then you can disinfect by applying the disinfectant to the surface, and the most common are the ones we mentioned in the last slide. Okay, daily activities and going out during COVID-19. So some things to ask yourself are how many people will be there because you want to decrease your chances of exposure. Will the space be outdoors or indoors? And will I be spending a lot of time talking to people? Okay, safety on public transportation. It is important to protect yourself when using public transit because it can put you in close contact, 6 feet or less, with others. Here are some general rules you can follow. Maintain social distancing and avoid overcrowded buses and trains. Wear masks, especially when social distancing cannot be maintained. Stay home if travel is non-essential. Remember hand hygiene and avoid touching surfaces. Okay, the slides are going to be on food safety and shopping. Food shopping is essential, and we must take the right precaution to protect ourselves while doing so. Here are some safe shopping tips. Practice hand hygiene, wear a mask, and maintain social distancing. Avoid the grocery store if you're sick or experiencing any symptoms of COVID-19. You can try online shopping or curbside pickup to limit exposure to others. Call your local stores to find out if they do home delivery or pre-orders for easy pickup. Drive-thrus might also be an option. Try to visit the store during off hours like late at night or early morning. Some stores have special early morning hours for the immunocompromised, elderly, and high-risk customers. Here's some other safe shopping tips. You will want to disinfect the shopping cart or basket before use. Use mark entry or exit points that follow any directional signs and floor markings designed to keep people at least 6 feet apart. Only touch products that you plan to purchase if that's possible. And when you get home, unpack your food by putting away perishables within 2 hours. And do not use disinfectants meant for hard surfaces like bleach or ammonia on food and item packages in cardboard and plastic wraps. Now I will pass it over to Lauren McDonald, where she will continue talking about coronavirus testing.
Hi guys. All right, so we're going to talk about testing for COVID-19. So there are 2 types of tests available for COVID-19. One is the diagnostic test, which is a swab that is placed inside your nose and or throat to see if you are currently infected. The antibody test is a blood test that may show if you were infected in the past. An antibody test may not show if you have current COVID-19 infection because it can take 1 to 3 weeks after infection for your body to make the antibodies. So why is testing important? Testing is important so that we know for sure who is infected so that we can take the necessary precautions to avoid spreading the virus. Antibody test results are especially important for detecting previous infections in people who had few or no symptoms because they show an immune response to the infection. So when should I get tested? You should get tested if you have symptoms of COVID-19. If you have had close contact within 6 feet for more than 10 minutes with someone with confirmed COVID-19, and if you get tested, you should self-quarantine at home until you get the test results and follow the advice of your healthcare provider. How much does it cost? COVID-19 tests are available at no cost nationwide at health centers and select pharmacies. The Families First Coronavirus Response Act ensures that COVID-19 testing is free to anyone in the US, including the uninsured. So where to get tested? If you have symptoms of COVID-19 and want to be tested, you should call your primary health care provider first, or you can visit any urgent care facility or participating pharmacy that provide free testing. It is recommended that you call ahead and schedule this appointment to be tested. To find local testing in your area, you can visit the New York State Department of Health website and type in your zip code in the COVID-19 test site finder at this website listed here. And individuals who have questions regarding eligibility or access for testing should call the New York State COVID-19 hotline at this phone number provided for you, or visit the New York State Department of Health website. So testing at Stony Brook University. Stony Brook University offers free drive-through testing. Location is South P parking lot off of Stony Brook Road. Appointments are required, so to make an appointment, you can call this number or visit this website to schedule that appointment. Hours of operation are Monday through Friday, 8 a.m. to 6, Saturday, 8 a.m. to 3, and we're closed on Sundays. Testing at Jones Beach. Jones Beach offers free drive-through testing at the Nature Center on the West End. Appointments are required. Again, you can call this phone number or visit this website to schedule your appointment. Hours of operation are every day, 7 to 7. So regarding your test results, so if you test positive, you should continue to self-quarantine and monitor your symptoms. You can be around others again after 10 days since your symptoms first appeared, and 24 hours with no fever without using fever-reducing medication. Also, your symptoms should be improving. However, loss of taste and smell could last for weeks to months after you recover. If you test negative, this means that you were probably not infected at the time the sample was taken. However, you should still take necessary precautions to protect yourself from becoming infected. So a question a lot of people have is, if I have COVID-19 and recover, can I get it again? So according to the CDC, we do not know if the antibodies that result from SARS-CoV-2, which is COVID-19 infection, will provide someone with protection or immunity from getting infected again. If antibodies do provide immunity, we don't know how many antibodies are protective or how long protection might last. The CDC scientists are currently conducting studies to answer these questions, but the data shows that a person who has had and recovered from COVID-19 may have low levels of the virus in their bodies for up to 3 months after diagnosis. This means that if the person who was recovered from COVID-19 is retested within 3 months of the initial infection, they may continue to have a positive test result, even if they're not spreading COVID-19. There are no confirmed reports to date of a person being reinfected with COVID-19 within 3 months of initial infection. Now I'm just going to mention New York State travel restrictions. So with the rising rates of COVID-19 in certain regions across the United States, New York State has put in efforts to stop the spread of the virus. For example, upon return to New York State, a 14-day quarantine is required for anyone coming from an affected state for longer than 24 hours. So here's a list of the up-to-date affected states that can be found at this website here. And for any other questions about travel, you can contact the Travel Advisory Hotline at this phone number. And I'd like to hand it over to Phil, who's going to discuss what the future looks like regarding COVID-19.
All right, everyone, we're going to talk about the future of COVID-19 and what our next few months might look like. So the future of COVID-19. By October 3rd, 2020, national predictions as of September 7th show an uncertain trend in new COVID-19 deaths reported over the next 4 weeks. By October 3rd, they predict that 3,000 to 8,000 new deaths will likely be reported. As of 2005 to 2017, COVID-19 deaths, a total of 205,000 to 217,000 COVID-19 deaths might be reported. COVID-19 is still a threat, and there are new cases every day. Primary prevention is important to control the spread of the disease, and we must follow these guidelines until there is a treatment for COVID-19. So what ways we might want to cope during COVID-19? All of us have maybe been experiencing different things regarding our family, our friends, our whole lifestyle being changed over the past few months. And it's important that we focus on ways to cope and deal with these changes that have been progressing. We want to make sure that we take breaks from the news, right? We don't want to focus all day on the news and the negativity. We want to obtain our information from certain areas and certain sources to make sure that it is good information and valid information. We want to make sure we take time to unwind and relax from a very stressful day at work or going out and taking that time to reconnect. We want to make sure that we set goals and priorities. Setting these goals and priorities will help us stay productive during this time. And we want to make sure we take care of our own bodies, whether that's eating well, exercising, offering relaxation to decrease stress. We want to make sure that we connect with others. During this time, this virtual time, it might be a very big change for some of us, but for others, it's also a very good opportunity to connect with other family, friends, and other people we may not have spoken to or lost contact with. And we want to make sure that in the end, we focus on the facts. A lot of misinformation or false information is spread throughout the news and different forms of social media. We want to make sure that our information is valid, and it's important to focus on the facts. So stress. During this unprecedented time, during this very difficult time of coronavirus, you may not know how to react or what to do. With so many unknowns and questions, it's not surprising to get overwhelmed. Stress can come in many ways. Due to the pandemic, you may experience the following: fear and worry about health of yourself and your loved ones, changes in your sleeping schedule, the inability or having difficulty sleeping or staying focused on a task, the increased use of tobacco, alcohol, or any other substance, and the worsening of your overall health and your mental health. Well, how can we reduce the stresses that we might be feeling during this time? We want to make sure that we educate ourselves on the signs and symptoms of COVID-19, know where and how to get treatment, make sure that we take breaks from watching the news and social media, connect with family and friends virtually to remain in touch, do some activities that you enjoy, whether it's exercise, meditation, yoga, reading a book, making sure that we eat well and eat balanced meals, and getting enough sleep. We want to make sure that we are all in this together. It's easy to forget and you might become feeling isolated, but always remember that we're in this together. You, your family, your friends, your neighbors, people at the store, we're all experiencing this together, and it's important to stay together as one. So with the enforcement of social distancing, it's easy to feel lonely and can be especially difficult for those who experience mental health conditions. We're all in this together and we will get through this together. We might be physically distant, but it's important to stay connected socially. We can hold virtual gatherings to stay in touch with friends and family. We can virtually work out with other people. We can even take free online courses. We can play games on our phone or online with friends. And we want to make sure that we're not alone. We want to make sure that you understand that you can reach out to anyone for help if you need it. There are other options as well. If you do not feel safe to see a health professional in person, there are other options. Medical services can be given remotely. So this allows for long-distance contact, care, education, and monitoring between the patient and the healthcare professional. So there's options for staying in touch with your healthcare provider, whether it be your physician, your nurse practitioner, your physician assistant, or whoever you might want to stay in close contact with. Through Zoom or other platforms, you can speak with your healthcare provider. Stony Brook Medicine offers healthcare services through telemedicine. You can call a representative at 631-638-0597, and they're Monday through Friday, 8 a.m. to 6 p.m. There's also options of House MD, which has phone number and email, and they offer affordable services virtually through telemedicine. Northwell Health telehealth services is also an option. CityMD Virtual Care additionally has offering options, and NYU Langone Virtual Urgent Care. These are all great options and might work differently based on your health insurance, but it's important to reach out and seek help if you do need it. I'm going to pass this off to Professor Bune, who's going to talk about some information and resources during COVID-19.
Thank you, Phil. Okay, so just know that we are going to be providing all of these resources to you, and it is available to you online through our help website as well as our YouTube site. And at the very end of these slides, resources slides, we will give you those sites. So you will be able to get all of this information and that we're mentioning right now. So the National Helpline resources, again, as you know, if immediate help in crisis, we would call 911, but these are other websites like the Disaster Distress Helpline, the National Suicide Prevention Lifeline, National Domestic Violence Hotline, National Child Abuse Hotline, National Sexual Assault Hotline, and the Suicide Prevention Lifeline as well. And then the Elder Care Locator, the Veterans Crisis Line, find a healthcare provider or treatment for substance use disorder and mental health. Again, for the SAMHSA National Helpline, the Suffolk County Crisis Response, the CPAP program at Stony Brook, and your crisis residence at Pilgrim, and your domestic violence, sexual assault 24-hour hotline is there as well. Your local hotline resources are response hotline, your LICADD substance abuse hotline, Talbot House, that's again a 24-hour substance abuse crisis number, the Adult Protective Services, your Child Protective Services, your Long Island Crisis Center, and the SC Department of Social Services Emergency Service Hotline, as well as your Sagamore Children's Crisis Respite House and Suffolk Crisis Respite Bed Network. So all these numbers will be available to you. Okay. For your food assistance resources, you have your SNAP, which is your Supplemental Nutrition Assistant Program, your WIC, Special Supplemental Nutrition Program for Women, Infants, and Children, Island Harvest, and your Long Island Cares. Your financial assistance and housing resources would be for your free low-cost Wi-Fi qualification at 1-800-SAFE-LINK. Your heat for assistance for paying energy bill, your mortgage assistance as well. And for housing, you have the illegal eviction number that you call, 911, ensure the police, your officer's identification, lease or public utility bill with your name and address if you're unable to get back into your apartment. Then you should call the court system, which is there as well. Additional resources are your Stony Brook Medicine Healthy Libraries program. Again, this is our YouTube. This is where you would be able to access all of those lists that I gave you. We also have a Facebook account, and then our website and our email address is right there, and our phone number specifically just for the Stony Brook Medicine Healthy Libraries program. So we're going to leave that a little longer for them so they can copy this particular slide. I'm gonna, in a little bit, I'm gonna pass you on to Phil again to continue on with our program.
All right, thank you everyone. I hope you guys enjoyed this presentation. Again, these great resources will be available to you from this PowerPoint. Also, if you want, you can contact your local libraries who can provide you more information regarding this webinar and other ones we may have done in the past and upcoming events through the help team. Again, the phone number for the help team is 631-216-8220. So I'm going to launch another poll. If you want to just take another few minutes just to take a look at this, answer the questions regarding the webinar and the information we just went over. Again, nothing personal will be taken from this webinar, just a general information if you guys don't mind filling this out. All right, a big thank you to those who did fill out the survey, and thank you very much. And we're going to continue on today. We're going to continue with any questions anyone here might have. Anything at all, feel free to unmute yourself. You can speak them out loud, or if you'd like to, you can enter them in the chat function, and we'll be happy to answer any questions you guys might have. If no one has any questions, anything at all, again, we're here to answer questions you guys might have. And if no questions at all, we do have some pre-prepared questions that we can, more than happy to go help walk through, and some common questions people might have.
Okay, so why is it important to get a flu vaccine this year? Since the peak for the flu and COVID-19 cases are around the same time, it is very important to get the flu vaccine. An annual seasonal flu vaccine is the best way to protect yourself against the flu. It is likely that flu viruses and the virus that caused COVID-19 will both spread this fall and winter. Healthcare systems could be overwhelmed treating both patients with flu and patients with COVID-19. This means that getting a flu vaccine during 2020 to 2021 is more important than ever. Flu vaccines have been shown to reduce the risk of flu illnesses, hospitalization, and death. Getting a flu vaccine can also save healthcare resources for the care of patients with COVID-19.
Okay, here's another question. How do I know the difference between flu, COVID-19, and the common cold? Both COVID-19 and the flu can have varying degrees of signs and symptoms ranging from no symptoms, which is asymptomatic, to severe symptoms. Common symptoms that COVID-19 and the flu share include fever or feeling feverish and chills, cough, shortness of breath or difficulty breathing, fatigue, sore throat, runny or stuffy nose, muscle pain or body aches, headache, and some people may have vomiting and diarrhea, though this is more common in children than adults. Change in or loss of taste and smell is specific to COVID-19. If you have any symptoms of COVID-19, the best way to know is to get tested.
So some people have a few questions. One common one is there a microchip to track me from the government in the vaccine? And the answer is no. There is no evidence to support that these claims are true. There will be no microchip of any kind in the vaccine. It was a conspiracy theory that claims that the coronavirus pandemic is a cover for a plan to implant trackable microchips and that the Microsoft co-founder Bill Gates is behind it. So again, there's no evidence to support this. This is just a conspiracy theory.
So is there a vaccine for COVID-19? Well, currently there is no vaccine available to prevent COVID-19. Vaccines are regulated by the FDA and the Food and Drug Authority. The FDA is in the process of expediting or trying to move fast with clinical trials for vaccines. They're also supporting product development and increasing manufacturing capacity for high priority vaccines for COVID-19. Realistically, vaccines take 12 months or longer to develop and go through many, many stages, ultimately producing an effective and safe vaccine. If a vaccine is approved after rigorous and many steps of testing for safety, effectiveness, and quality, it takes time to produce, distribute, and get out throughout the entire global population. There has been mention of a vaccine to be available as soon as late October, early November. However, this information has not been formally confirmed. Current updates of vaccine progress can be found at this New York Times website, interactive coronavirus link. And we want to reassure everyone that the vaccine should not be prematurely or early released because it's important that it goes through many, many rounds of safe testing throughout the country. Okay, so does anybody have any questions? Any comments?
I have a question. A common question that I've heard communities ask is, will the flu vaccine help me with my risk of COVID? And how effective is the flu vaccine to reduce my risk of the flu? So it's really two questions.
Anyone have any ideas? Students?
Yes, well, the coronavirus vaccine, when there is one, and the flu, the influenza virus, are two different diseases. So the influenza virus or getting the flu Someone can get that, and unfortunately, you can also get the coronavirus or COVID-19. The vaccination or treatment for either of those are separate and they're specific to each individual disease. Getting the flu vaccine will not specifically, it will only specifically work and decrease your chances of getting the flu this year. Getting the flu vaccine will not affect your chances of getting COVID-19 or obtaining the coronavirus. To prevent those chances of getting the coronavirus, it's important that we follow those primary preventions of hand washing, social distancing, wearing a mask, and always washing our hands.
Thank you.